taping our endotracheal tubes. And we do that with H-tape. We'll do that with H-tape at Parker and Castle Rock always, and then here at Littleton, we'll do it in emergency situations and in the delivery room before we change them to a neobar. We could go that route. So this baby is intubated. Obviously, someone would be bagging this baby and securing their tube with their finger at the roof of the mouth. But since I'm only one person, so to cut our tape, and since we have a pretty big baby, you'll use this white tape that is located in the bottom drawer of all of our airway boxes. And you just cut that like a little H. Bring it close. This middle part of the H actually needs to be pretty narrow. Like that. Okay. So then you come over here, and this top part is just a mustache, like that. And this bottom part, someone's finger's still gonna be here, so consider that, but you'll just roll it up the tube, and always, always, always make yourself a little tab, so that when we're trying to undo it, if we need to adjust the tube, it's not some adhesive, terrible mess from sitting under the heat. And you'll do the same thing on the other side. And fold that over. And then you'll get one really big piece of this pink tape. Pink with a C. And that's also located in the bottom of this box. So just like that. Since this baby is really big, it's gonna be an even bigger piece. Hopefully that's enough. And this is your anchor tape. So you start on one side of the baby's face, and then you'll go down and around to the other side. And if it's too long, which is a better problem to have than too short, you can just easily trim it like that. Okay, now we, now we have a really secure tape. This is what the tape looks like when it's off of the baby. So over here I have a pen for size, and then this would be for our term baby. And we would obviously, when we're putting it on, these are the terminal edges that we fold over so that it's easier to untape the tube. Over here is something we might have for our premature baby. And so what I did here was I cut off the bottom of this tape because the baby's upper lip probably isn't going to be this big. So then I just made a tinier H with a thinner piece of tape and a slightly smaller piece of pink tape. But again, always good to have too long of a piece of pink tape than too short.